Now let's look at how we are going to treat a patient with PSC. The problem here is that there is no definitive medical curative treatment available, or there is no definitive medical cure. There are no certain drugs that are used to cure the disease. So our primary basic focus in patients with primary sclerosing cholangitis is, number one, to avoid the progression of disease, and the number two is to avoid the development of complications. And if the complications develop, then we do serial procedures to avoid the progression of those complications. So the number one thing is to treat the underlying disease. If the patient has primary sclerosing cholangitis along with ulcerative colitis, then we also manage ulcerative colitis. If the disease has certain association, like the certain fibrotic disorders like we discussed in the disease association, then we focus on treating the underlying cause. And most of the times that helps us in relieving a lot of symptoms of primary sclerosing cholangitis. We try to avoid the development of complications by slowing down the progression of the disease. But if the complications develop, then we are going to manage them in the best way possible. Along with that, if there are certain strictures formed and they can be managed with the help of certain therapeutic procedures, then we can do endoscopically dilatation of those strictures to relieve the obstruction and manage the bile flow. This can also be done through a percutaneous transhepatic cholangiogram, but this endoscopic procedure is generally well tolerated and more safer. And the definitive cure, which if we have only one definitive option, then that is the liver transplant. If we transplant the liver, then generally it takes care of the disease and the patient is disease-free. But this is not possible in all the patients because of the availability of the transplant. The transplanted liver, that we have to look at a lot of things with the matching of the donors, and then we have to look at the overall patient's comorbidities as well, that whether the patient will be able to tolerate this liver transplant as well. But if we talk about the cure of the disease, then liver transplant is the only cure. All the other medical management is aimed at managing the various signs and symptoms and complications of this disease. So what is the management of the disorder? Number one, there is no medical cure. So there is a symptomatology that is what we manage. If the patient has more difficulty in the flow of the bile, then to alleviate those symptoms, we can use certain types of drugs like ursodeoxycholic acid or UDCA. It is also abbreviated as ursodiol. This is basically a water-soluble bile salt which is synthesized, and this is given to the patients to basically improve their bile flow. Since this is a water-soluble product, it can be secreted into the kidney. This has had mixed results. It is more helpful to the patients with primary biliary cholangitis. And since it was useful in those patients, we tried and used it in a few patients of primary sclerosing cholangitis. It helped a few patients, and in certain patients, it did not have any effect at all. So this is basically a trial and error process that can be tried to alleviate the symptom. It does not have any significant side effects since it is a water-soluble product, and you can easily remove it through your kidneys as well. If we have the development of complications like cholangitis, ascending cholangitis, if there is certain infection, then we can use antibiotics as well. Based on the cultures which we have, we can use that cover the gram-negative and the various gram-positive as well. So antibiotics can be used to treat the cholangitis. If itching is a prominent feature, then we can use a drug like cholestyramine. Cholestyramine has been very helpful, and it is one of the types of fibrate derivatives that is used to treat hypertriglyceridemia as well. So itching can be very well managed with cholestyramine, and it has shown very beneficial effects, specifically in patient population that had very pronounced itching, which was interfering with their day-to-day routine. Now, if we have a development of ascites and portal hypertension, and then we develop bleeding through the esophageal varices, then we can do endoscopic procedures. We can do ERCP as well to relieve the strictures if there is formation of the strictures in the biliary tree. But if the patient develops bleeding varices, then we can basically do endoscopic band ligation of these varices, and then we can try the various drugs as well like IV octreotide or propranolol, or the beta blockers like nadolol, etc., to vasoconstrict these vessels at first to stop the bleeding, and then we can do banding or sclerotherapy endoscopically as well. And finally, the definitive treatment is liver transplant. Liver transplant is the only curative option which we have in these patients. Without liver transplant, the patient has a median survival of 10 to 12 years after the diagnosis. So if someone does not undergo liver transplant, basically they're going to more or likely die in the next decade or so, depending on the severity of the disease. So this was all about the overview of the management of primary sclerosing cholangitis.